they're really important. Just their mere presence is really important for our formation of our immune system and our immune tolerance, and it has a really big communication back and forth with how our immune system works. So that plays a really large role there as well. They're important in our digestive processes, our elimination processes, how we deal with different pharmaceutical medications. Like the list basically can go on and on, how they can really have a benefit for us. If we were to wipe all the microbes off your system, you'd be dead within minutes.
Welcome to the Radical Health Rebel podcast with your host, Leigh Brandon. If you enjoy the podcast, please leave a 5-star rating and a warm review. And now, here is Leigh, the Radical Health Rebel, with this week's podcast.
Debbie Cotton, welcome to the Radical Health Rebel podcast. Thanks for coming on the show.
Thanks for having me, Leigh. Lovely to be here.
Yeah, I'm really, really excited about this episode. So today's episode is entitled The Human Microbiome, the Final Frontier with Debbie Cotton. Now, the human microbiome is a subject that has really fascinated me over the last 17 years or so. And it's fair to say that we seem to be learning more and more about the microbiome at an ever increasing rate. A subject where there's almost certainly far more to learn than we already know. And I feel that it may well be possible that we will never fully learn everything about the complex interactions that we as humans and other animals have with the microbiome and the effects we have on it and it has on us. But what I do know from my own studies and clinical practice is that the microbiome plays an absolutely vital role in our health. So I'm really looking forward to this deep dive into the world of the human microbiome with the extremely knowledgeable Debbie Cotton.
Thanks, Leigh.
So Debbie, to kick things off, would you mind sharing a little about you, perhaps your upbringing, your professional education, your career to date, and what led you to becoming so passionate about the human microbiome?
Sure. So I grew up in Australia, as you can probably hear from my accent. So I spent a lot of time in the natural world. I was very lucky in that way. It was a part of my lifestyle. So for me, in my journey, I had a bit of a health crisis when I was quite young, being diagnosed with an autoimmune condition, and went down the medical route as most do. And I lost kind of faith quite quickly in what that would bring me, because at that time my prognosis was looking like wheelchairs and things quite early on in my life. So I kind of came full circle and turned back to the natural world as best as I could to try and understand. And really, you know, as most practitioners do, you come back to this point of where you're trying to find a way to support yourself through your own processes. And then, of course, as I was learning, wanted to use that to kind of encourage others to take a little bit more empowerment over their health journeys. And, you know, that's not saying that the medical community isn't amazing, because it absolutely is. But what are we missing by not bringing in all of these other things that are available to us in the natural world? And that's basically my journey as a practitioner in short. And yeah, so from there, I've kind of studied in lots of things, and it keeps growing and growing and growing. And really everything I study, my whole focus is how can we encompass all of us, whether that's all of us from a psychological, mental, emotional point of view, whether that's all of us from an environmental point of view. And when we talk about all of us from a microbiome point of view, that's so important, because it really involves the environment in which we live, the environment in which we've grew up, and the environment that we carry within us. So that's where the microbiome fits in for me. It's taking into account, the all of us.
Sure. And what was your main kind of qualification that you started with?
So I started with, I started in music, actually, of all things, in early childhood education, but actually it was an advanced diploma in naturopathy, which was herbal medicine and nutritional medicine. It was a dual diploma. I then went on to get my bachelor's of health science, and then from there did quite a lot of sort of work in the mental health field. So I've got many diplomas in kind of body psychotherapy, and then went on to do my MA in integrative psychotherapy. So that's kind of my journey through that way.
And what was it about the microbiome that kind of grabbed you, so to speak?
I think the thing is, it's that really making sense of, that actually we're a part of an ecosystem. I think that's what's really always important for me, is how do we relate to the natural world? And the microbiome is the natural world that we carry within us. It's this little amazing ecosystem that's within us, it's on us, it's around us. And it's those interactions and the movements of those microbes that have a really big impact on us. And it all comes down to relationships. What's our relationship like with these little creatures, basically? And that, again, is another big one for me, is our relationship with these parts of ourselves.
Gotcha. And can you share with the audience a little bit about your current role?
Sure. So at the moment, as well as being sort of a clinician in my own right, with kind of private practice, I also am the head of clinical education for In Vivo Healthcare, which is a microbiome company. And what we do is specialize in microbiome testing and also therapeutics that help with the microbiome as well. So they're a wonderful company to work with.
Yes.
And, they fuel my sort of ever curiosity in this area, which is great, which I'm very, very thankful for.
Yeah. And obviously, as you know, Debbie, I use your services quite a lot for testing, use a lot, recommend a lot of your supplementation as well. And also do a lot of your education that you thankfully provide to people like me, which has been a godsend in the last certainly 10 years. I mean, how fast the new information that's coming out about microbiome all the time. And what I love about your company is that you do all the research and package it up into a nice little package, and probably save me a couple of 100 hours a year having to read through all the studies. So thank you very much for that.
Oh, my pleasure. And that's what I love to do, basically, is kind of get the research and trying to make it as digestible as possible. And not always possible, but we try our best. And but like you say, it's an ever expanding area. So it's just amazing. Like every day there's something new to learn, which I love.
Me too. So I guess my first question might well be the biggest question, but probably an important question to ask at this stage. But what is the human microbiome and what does it do?
Sure. So microbiome basically is a term that we use to talk about the conglomerate of microbes that live within us and on us in relation to us. So when we talk about a microbiome, we're talking about the microbes, which can be anything from bacteria, viruses, fungi, phages, all of these things, and the host, which is us. So it's the combination of them and the environment is microbiome. That's what we're talking about. If we talk about the microbiota, we're just talking about the kind of the microbial part. But to be honest, we always have to talk about the microbiome, which is the environment in which they live, because, the community of microbes that live together is always dependent on the environment in which they are. And we are that environment for them.
And what does it do?
Another great question. So the microbiome does a lot. So the microbiome in itself is, is a thriving community of microbes that are trying to do their own daily things, their own metabolism, their own reproduction, their own trying to get food, all of that sort of stuff. They want to grow and flourish as well. Now, because they live with us and on us as the host, a lot of the microbes in the different communities that live within our body generally confer us different benefits, and they can be a whole number of benefits, whether it's some of the byproducts they make from their own metabolism. They might kick out things that we need. So that could be things in the gut, say like vitamin B12 or things, byproducts known as short chain fatty acids. All of these things we can use as a human being. So, sometimes they make things for us. Just by the presence of them being there, they stop the colonization of pathogens. So that's microbes that are generally what we'd know called germs, that are trying to cause illness. So they can prevent sort of illnesses in that way as well. They're really important. Just their mere presence is really important for our formation of our immune system and our immune tolerance, and has a really big communication back and forth with how our immune system works. So that plays a really large role there as well. They're important in our digestive processes, our elimination processes, how we deal with different pharmaceutical medications. Like the list basically can go on, how they can really have a benefit for us. If we were to wipe all the microbes off your system, you'd be dead within minutes. Okay, you wouldn't survive. We are our microbes. We cannot live without them. So,
yeah, which just reminded me of. So I was at the gym this morning, and there's people at the gym that walk around with antibiotic sprays in their hands, and they soak the machine before they use it. They're on the machine for a few seconds. They're not sweating. They get off and they pick up their spray and they're spraying down the machine, and it's going everywhere. It's going into the air, and it's just like, what, you don't realize what you're actually doing, which, you can't say anything to people because, people have been so frightened into killing germs in the last 3 years. But that's another can of worms that we won't be going down today. Can you talk a little bit more about short chain fatty acids and how they work?
Sure. So if we focus on, I'll just back up a little bit, which is basically we have many microbiomes in our body. So we've got one in the mouth, one up the nose, one on your eye, under your armpit, but the one that has received a lot of attention is the microbiome in our gut. And the reason for that is because it's a very diverse microbiome, because there's so much food matter that we obviously eat that goes into there. Now, the composition of that microbiome is really dependent on what you got given by your mother, how you got fed as an infant, did you have pets or not, what environment you were brought up in, the people you've been around, but also the food that you eat. So it's all of those things go into making your gut microbiome. And like I mentioned earlier, a lot of these microbes in your gut, as you eat your food, they can too digest it. They like little kind of portions that come out of your food. And often what they poo out is something that can be beneficial for us. And these are known as the metabolites. Short chain fatty acids are the metabolites that certain bacteria in our gut make when they get hold of fiber. Now, fiber is indigestible to us as a human. You eat it, we don't have the enzymes ourselves to break it apart, so it goes out the other end. So it's really good for pooing. But fibers also, depending on the linkages that make them, can feed certain types of bacteria, and they can then make short chain fatty acids. And some really common ones of these are butyrate is a well-known one, but propionate, lactate, there's lots of other different fatty acids. And there's a lot of beautiful research out there how important these short chain fatty acids are for, first of all, our gut health. So the cells in our epithelial layer in our gut require butyrate for fuel. So isn't that a beautiful symbiosis that the bacteria actually make the fuel for the health of our gut lining? But also butyrate has been shown to be used around the body for many metabolic processes. It has it's important in babies for brain health and development. It plays a role in sort of normal metabolism and sort of how we metabolize glucose and things like that as well. It can be anti-inflammatory. So it's used by lots of different processes in the body. And like I said, what you need there is two elements. You need fiber, so you need to eat the fiber, and you need the microbes that can then digest it to be able to get hold of them.
Awesome. So you've mentioned a few already, but what are some of the key microbiomes, in our bodies, if you like?
So I would say all of them are key, but it's the ones that are the most researched at the moment that we have the information upon. So we've got the oral microbiome, which is very, very key for obviously oral health, but it's remembering the gums go straight into your bloodstream. So a really important barrier between, it's a really important communication barrier between you and the rest of the body around the metabolites that can get in, but also pathogens. So the health of the oral microbiome is quite important. We've got the gut microbiome, and that consists of different niches as we go down from, the stomach to the small intestine to the large intestine. All look a little different because there's slightly different environments. And that plays a major, major role in our health. We've got the vaginal microbiota, which plays a major role in women's health, but also in fertility. We've got the male penile and seminal microbiome, which again plays a major role in males' health and kind of fertility and things as well. And obviously there's the skin microbiome, which is ever so popular at the moment when it comes to, anti-aging and kind of skin health, but also aesthetics and those sort of things as well. So, but yeah, if you can think of it, there's a microbiome for it, basically.
Yeah. But in terms of, what you've read up about, if you were to say, I don't know, there's a key 3 or 5 regions of microbiome that's the most important to health, what would you say?
So
I'm backing you into a corner now, Debbie.
Yeah, trying. Gut, number 1. Oral and vaginal / penile. Actually, and in the vagina here, I'm going to cheat. In the vaginal, I say the genitourinary, so the bladder and the vagina. And probably the skin as well. The lung. I don't know. See, I can't decide there. They all have a significant contribution. Yeah. That's the thing, Leigh. It's like. The gut would be number 1, though, because of the amount of metabolites that we have to deal with and how it has an impact on all of our body systems, from what comes in and what goes out there.
Yeah. And I suppose the lung has been obviously one that's been very prevalent in the last 3 years as well, with obviously the pandemic.
Absolutely.
So that's been right up there. So yeah, you definitely can't not have that in the list. I mean, for me, the skin is a really important one for me personally, because again, I don't want to bore my listeners, but I had severe acne for 18 years. So that's an area that I've delved into quite a lot myself. But yeah, I would say in terms of overall health, I would probably put the lungs above the skin. But obviously, the skin is our outer immune system, isn't it? It's our first line of defense, so to speak.
It's a very important barrier, and also it's about how you feel in your body, which is really important too. So
definitely. So, got another really tiny question for you here.
Yeah, sure. Go on, Leigh.
What kind of things can upset the balance of the microbiome?
Brilliant. So many, many factors, basically. If we think of microbiomes within us and also in our environment as really delicate ecosystems, we can then make parallels with what's going on, around the world when we deforest or when we take apex predators out of an ecosystem, when we pollute the water. All of these things totally changes, we know, the animals that live within an ecosystem. That's true of the microbes as well. Okay, so the microbes in an ecosystem change. So if we then bring that sort of same parallel back within us, we need to think about often, what are we doing in our own ecosystem as the host? What are we changing? What are we damaging that in turn will damage the microbiome? And what's well known is things like antibiotic use. Now, antibiotics are obviously really important if you have an infection, but their overuse, and especially in the food chain and things like this, will create a change in the overall ecosystem of the microbiome.
And sorry, when you say the food chain, you mean the fact that they're fed to animals,
Yes.
farm animals?
Yeah.
Yeah.
So when they're fed to farm animals or used in kind of any farming kind of situations, basically. Antimicrobials, like you were saying about the gym, those sort of things, when we expose an area to lots of antimicrobials, you're going to change the microbial environment, the microbial diversity. And we interact with that. And, you know, there's an exchange all the time. And if there's a change, there's going to be a change within us too. Pharmaceutical medications can have a really big impact on our microbial environment. What we do or don't eat can both impact our microbes. So remembering that they need to be fueled. So they do need access to fiber. They need access to even other microbes in the environment, you know, the healthy microbial matter on food from, say, fermented foods and things like this. You know, a part of that, an extension of that is infant nutrition. Exposure to breast milk is an amazing way of increasing the diversity of the ecosystem of a microbiome. Interactions with our environment. So there's lots of research around, you know, were you brought up in a city? Were you brought up in the country? Were you brought up on a farm? All of these things will change the way your microbiome looks because of what microbes you've associated with as you've grown up, and then therefore what if it's become a part of your community. You know, a lot of things like emulsifiers and additives and things that are added to food have been shown to damage the gut microbiome. So that's also quite well known as well. Yeah, so the list unfortunately can go on, but there are lots of factors that we know does damage the microbiome. And the trouble is, and Martin Blazer, for anyone that's interested in reading his work, sometimes we haven't taken stock of what we've got to know what is missing. So I think we're at the point now with humans that we know there's a lot of microbes missing, but because, you know, the measurement scales have only just kicked in kind of really recently of identifying some of these microbes, we may be already missing microbes that we didn't realize are gone. So, and we don't know, you know, what the overall impact of that's going to be on human health.
Yeah. And can you talk a little bit about childbirth and infancy and how that is affected?
Yeah, absolutely. So, we have a vaginal microbiome, which is generally very lactobacilli rich, but there's other microbes in there as well. And, you know, when a baby is in the womb, it's getting exposure of microbial metabolites from mum, and that's from the oral microbiome and the gut microbiome. It's getting bathed in the metabolites. Sometimes there's also translocation of bacteria, as far as we're aware. That this science is a bit new. There's possibly a placental microbiome. You'll have two schools of thought around that. There's two research schools of thought ones, but you know that actually the microbiome might start before you're even born, basically from your mum. But then when you're birthed, you've got, you know, the two routes out, which is either vaginally, and with a vaginal birth, you're going to get all those microbes from your mum's vagina pushed up your mouth, your nose. Often there's a little bit of poo involved in birth, which, you know, again, is a bit of an inoculation of your mum's microbiome into you. And there's really clear research, again, if that's not the mode of delivery, that you've come out via C-section, you're more likely to be colonized with first kind of room bacteria, the type of bacteria that would be on the surgeon's hands, so on and so forth, would be your kind of colonizing early bacteria. So there's a very big difference between mode of delivery around what's going to be the first bacteria that colonize your gut. And then to go on to feeding, you know, so access to the breast and breast milk, because breast milk contains really, really special, what we call oligosaccharides. You could almost say it's a type of fiber that we make specifically for microbes. It only feeds microbes, and it will feed things like bifidobacterium. So being access to breast milk will grow the microbiome in a certain way, whereas access to formula will grow the microbiome in another way. So it's just all of these sort of little things in your growing up will have an impact on how your microbiome looks as an adult.
So if we had someone who had a normal birth or breastfed, how may they compare to someone who was born via a C-section and bottle fed?
So generally what you see in the research is a slightly different diversity of the big families that take up residency in the gut. So when we're looking at microbiome research, it's tricky. You know, it's never a simple thing to kind of look at. Normally what we're looking at is things like diversity indexes, which is like how many microbes have you got in there. It used to be linked, the more microbes, the better, but sometimes diversity is complex because it's very much linked to the next thing, which is the types of families. So you can have diversity of the wrong types or diversity of the right types. So there's a little bit of, you know, two things that need to go together. We do need diversity, but we need a healthy diversity.
Gotcha.
And the microbial communities, you know, within these two different people can look very, very different. Like what maybe the overall, there's still a lot of microbes in there, but, you know, one might have a higher percentage of, say, bifidobacterium, and one might have a higher percentage of, say, streptococci, or, you know, so the overall kind of balance within the community looks very, very different. And then when you go on and link these with kind of human health, you know, a lot of the research is, it's hard to kind of pin it down, but, you know, we're looking at how these communities and the balance within the communities then have an impact on human health and disease. So that's kind of how we're kind of trying to track all of these things.
And in terms of diversity of different types of microbes, I'm guessing that's 100% environment. Is there a genetic component there?
There's a slight genetic component when it comes to the microbiome, and what that genetic component is that you know, basically we secrete some parts from our immune system, and that can actually interact with the microbiome, and sometimes even, you know, feed the microbiome to a certain extent, especially through breast milk. And so certain genetic propensities will make slightly different linkages. So you can be what we call a secretor or a non-secretor. So you might kind of be better at feeding, say, bifidobacteria than someone else that's a non-secretor, if that makes sense. So genetics have a small role to play, but the major role, like you just said, Leigh, and you've nailed it on the head, is environment. It's kind of, and it's that process of all the way through the environments that you interact with, and then what assaults you've had on that environment. So again, going back to the research of Martin Blazer and others, they've shown the earlier that you've had exposure to antibiotics increases that sort of propensity for problems with health later in life because of that early knocking of the diversity of the microbiome. Whereas if you have antibiotics kind of more in your adult life, you're generally a lot more stable and you can deal with it and recover a lot better. And again, doesn't seem to be linked with the chronic health diseases that it does when it's timed in early life. So it's that thing of realizing that actually there are windows of opportunity of growth of the microbiome that we're only just trying to get our head around, you know, developmental windows basically where the microbiome is rapidly setting itself. And they're important points where we want kind of a good interaction with the environment as best as we can.
So just listening to what you were saying there, I was thinking, I had life-saving surgery when I was 6 weeks old, so I would have had antibiotics. I was bottle-fed, and I was on antibiotics for 18 years. So I'm guessing it's no surprise I've been fighting against the tide a little bit for the last 20 years.
Yeah.
But managed to keep on top of it.
And that's the amazing thing about the microbiome. It's robust as well. It's evolved, even with all those factors, to still be as healthful as it can be for you. Does that make sense? It's, you know, it also speaks to the resilience of us and our microbiomes as well. But yes, unfortunately, you would have been fighting the tide of, you know, it's that sort of, unfortunately, it's that winning the microbial lottery or not sometimes.
Yeah. I mean, I'm not complaining, because without that surgery when I was 6 weeks old, I wouldn't be speaking to you now.
Absolutely. It's life-saving, like you say. So,
and that's what our medical system is really good at, is saving lives,
yeah,
in acute situations. Just earlier you were speaking, and something came to mind, and I'm sure you're aware of it, is the studies where they take people from westernized cities and they plant them into hunter-gatherer families in Africa, and they live with them and they eat their food. And over time, their microbiome starts to shift to be very similar, if not the same, as the hunter-gatherers.
Yeah, there's also some really interesting research that goes the other direction, which is actually really disturbing as well, where people have come from hunter-gatherer societies, or there was also a good one, people that had immigrated from Thailand, I think, and they'd immigrated to the States, and basically within 3 months, they'd lost a lot of the kind of bacterial families that they were using a lot in kind of Thailand to digest certain foods, had kind of very, very quickly had come to reflect a microbiome of the Western sort of style diet. So, yeah, and that's a combination of diet, but the research were also saying, and environment. It's not just, it's both. You can't kind of, it's the environment in which they've moved to as well.
Yeah, and Dr. Zach Bush talks a lot about that as well, doesn't he? Yeah.
Yeah, he's fabulous if you get a chance to listen to him, anyone out there.
Yeah, hopefully I'll get him on the show at some point. My next question, I guess, really is in your wheelhouse, I guess. Can you explain a little bit about the gut-brain axis?
Sure. So this is a really interesting one. So basically, our gut is linked really intrinsically with our central nervous system. We've got the enteric nervous system. So there's a lot of feedback that goes between our brain to our gut, but to our, and that's about the processes that are going on in our gut, so on and so forth. But there's a lot of feedback that goes gut to brain as well. And a lot of the early research was just looking at that kind of nervous system connection around that, what's going back and forth, kind of sensory wise. And, but equally, there's a lot of feedback that goes back to the brain from the gut via the metabolites that, go through from microbial kind of decomposition as well. And those metabolites, again, we're talking about short chain fatty acids earlier, but some other metabolites that are made are things like even neurotransmitters, which are normally in our brain to kind of communicate between two neurons, are also made not only in the gut, but also by some microbes as well. And they can have an influence on, those kind of the nervous, what's the word I'm looking for, signals that go back, towards the brain and kind of the information that's going that way. Also, some of those metabolites can go through the bloodstream, different ones, and they can then get picked up by the brain, the central nervous system, and have an influence on how our brain functions. And another really big way that kind of our gut influences our brain is that I spoke at the beginning quickly around how microbes have a really big role to play in our immune system, and microbes and the metabolites and also their sheer presence can either do one of two things. They can say to the immune system, hey, all is well, chill out, there's nothing to worry about. Or in the case of kind of disrupted bacterial communities or the presence of, pathogens or communities that are growing too large, they can actually send inflammatory signals. And this can inflame the immune system, and which in turn, all of those kind of byproducts from inflammation from the immune system have a direct input on the central nervous system and can be linked with things like depression and bipolar and so on and so forth. So our gut and our microbes play a really, really big role in our sort of balance when it comes to our mental health. Now, of course, it's not the only thing, trauma and all these other things play a role as well. But the interesting thing is when you look at those papers, like people that have suffered from childhood trauma often have different microbiomes. And it's just very, very interesting how all of this stuff really links together in that sort of holistic viewpoint.
Yeah, I guess it would be quite exciting to see if medical doctors, rather than just handing out pills for people with mental health issues, actually looked a little bit more holistically at the problem.
Yeah, there's some great research. I don't know if you know Felice Jacka and the Food Mood Centre in Australia. Is doing some wonderful research on how food interventions change the microbiome, but also can be helpful in depression. And, you know, these guys are really trying to get that sort of idea into everyday health services, you know, not kind of highfalutin ideas, just really simple changes that can be made to change the microbiome, to change gut health, that in therefore can have an impact on mental health, as well as, you know, the other support mechanisms that are needed as well. So
yeah. Can you tell us a little bit about the gut skin axis?
Again, it's a very sort of similar kind of story to the one of the sort of the gut brain axis around the, you know, our gut is the most important place for where we take everything in, but also where we eliminate things. And it's an important barrier, like the skin is to our immune system, for our immune system. And again, if we have that kind of dysbiosis in our gut, which is a term to say imbalance, where we're tending towards more pathogenic bacteria, or maybe not enough of the bacteria that do make the good metabolites for us, we can then skew the immune system, towards that more pro-inflammatory state. And again, all of those metabolites can impact our skin. And if we're having trouble with elimination, that can really, the skin is another area where we try and detoxify, so that stuff can push through our skin if we're struggling with kind of different kind of metabolite build-ups in the body as well. So yes, definitely, Leigh, like in your case, I'm sure you've had your own experience around this, so around how important it is to look after your gut microbiome, the immune system in your gut, you know, the health of your gut in general. If you want to work with your skin, it's that working from the inside out is so important. Yeah,
and I guess probably even more important from immune system views will be eczema and psoriasis as well, even more than acne, I would say.
Yeah, I guess with acne, there's also a big hormonal link often in many cases, isn't there? And you know, again, elimination of hormones and microbes can play a really big role in that. And so again, it does come back to how the gut is functioning and how our microbes are.
Yeah. Now, we've touched on it a little bit already, but in your experience, what effect does diet have on the microbiome? If you can go into a little bit more detail.
Diet, you know, especially as we, you know, there's many factors that influence the microbiome. The one that we have more control over than anything else is diet, you know, when it comes to how our microbiomes flourish. So it's not always going to be the whole answer in many cases, but it's going to be a big one because it's something we can do. We can't necessarily change where we live. We can't change our birth story. We can't change if we've had antibiotics in the past. We can't, you know, those things we can't change, but we can change how we feed our microbiome today. So the more access we have to fresh fruit and vegetables that are really, really high in fiber, that have got a lot of different phytochemicals in, so that can be seen by the different colors of the fruit and vegetables that you're working with. Things that have been eaten with different cooking styles, you know, because that will give us different metabolites that our microbes can use. Things that have been exposed to fermentation, because again, you're exposing yourself to bacteria or sometimes dead bacterial matter or, you know, metabolites, all of which can have a really big influence on your microbiome. Second to that, after diet, would be your house environment. You know, again, you might not be able to influence where you live, but you might be able to influence some of the things that you use in the home. You know, and if you're using antimicrobial sprays, or if you have got access to green space, you know, all of these things can be a way of kind of really increasing your kind of microbial matter and health and diversity.
Yeah, can you talk a little bit about the research that's been done in terms of different types of diets and the types of microbiomes that we tend to find in different types of diets?
Sure. So, you know, again, it's this thing about patterns is what we see in the microbiome. So if you feed your microbiome certain foods, you're going to grow it in a certain way. So you'll find that if you're on a ketogenic diet, you're going to have a certain looking microbiome. If you are on a plant-based diet, you're going to have a different looking microbiome. If you're a pescatarian, again, and of course there's going to be variances within that, but we like to kind of pull out the patterns. And, you know, again, what's generally thought to be the most healthful is the one in which there is a healthy diversity of good bacteria, not the pathogenic ones. But, you know, again, these different diets can be good interventions for different conditions, basically. So, yeah, so that, yes, there can be a really big impact on what type of diet you're doing to what your microbiome does look like.
Yeah, and you've just led me on to what I was going to ask you next very nicely. So one of the things that we're seeing quite a lot of now, and I think it's probably Michaela Peterson that probably is to blame for most of it. But I don't know if you know the story of Michaela Peterson. That's Jordan Peterson's daughter, and she had really severe autoimmune problems, and she was in a lot of pain. And over a period of years, she was trying all these different elimination diets. And eventually, the only diet that she could eat that got rid of her pain was a carnivore diet.
Right.
And, you know, I'm certainly seeing, I don't know why, but I'm certainly seeing a lot of people posting on social media how they, you know, they've now gone carnivore. I know Joe Rogan did it for a little while, and he sort of said, "Oh, I lost lots of body fat, etc."
Bear Grylls has gone that way, hasn't he?
Has he? All right, I didn't know.
Yeah.
But I'm just wondering if you've seen any kind of research on carnivore diets and what your thoughts are generally in terms of its effects on the microbiome, because, you know, people do certainly seem to be having at least short-term benefits from a carnivore diet.
Any major dietary change, so whether that's carnivore, keto, vegan, whatever it might be, will have an impact on the microbiome. And if you had a dysbiotic microbiome in the first place and you apply these diets, that short-term impact of the microbiome change may be a really, really helpful one for you and your condition. What is the kind of question and concern about many of these different diets that cut out factors out of our diet is that we don't have the long-term sort of research on, you know, on how that change in the microbiome is good for kind of a chronic health perspective. Does that make sense? So
yeah.
We often find, you know, a shock to the system of any description, and that could be, you know, I don't know, the grape diet, the you know, cabbage only diet, whatever, can sometimes temporarily fix a problem. Does that, especially because it often takes you away from the original problem, which is a Western diet, or it's removed, you know, some sort of microbe somehow by basically starving it out. But that may not be the best thing for the overall ecosystem in the long term. And that's where I think any of these things, I think when we've got a radical diet like the carnivore diet or anything along those lines, that's amazing that people are getting benefits. And what we don't have is the long-term research around what that looks like in 50, 60, 70 years, you know, and it'll come, hopefully. It'll come. Yeah. You know, all this research, unfortunately, takes time.
Yeah, I mean, I guess one thing you can do is look back at evolution. And I guess there are certain parts of the world where they would have had very little access to plants all year round. Like if you lived near the North Pole, you would have had very little access to bananas and oranges and all other kinds of plants.
Absolutely, but they did have access to certain berries at certain times of the seasons that they'd binge on and things like that. So you would have
they'd also eat the contents of the viscera of the animals that would have eaten seaweed and things like that as well. Yeah.
So and this is again speaks to the amazingness of humans and the resilience of humans, that actually we can survive in lots of different environments, under lots of different conditions, with lots of different diets. And I think what we need to remember is how we do that is the development of the microbes that we have a relationship with. So if you look at the Japanese population, they actually have specialized microbes for a lot of the kind of the soy and the seaweeds that they eat that help them digest them. To us over here, we'll have different kind of specialized microbes that will help other things that we digest. So it's that, again, that co-evolution. And I think this is where we need to get away from we all would have looked the same, because we never have. We look like humans that co-evolved with microbes in that particular area to eat a certain way. You know, a really beautiful example of this is I've just come back from Australia, is koalas in the natural world. You know, if anyone else was trying to live on a gum leaf diet, would die pretty quickly, or any other animal as well. But they've evolved the microbes that can help them digest them, you know, and not be toxic to them. Amazing. So it's that co-evolution that we always need to keep coming back to. Yeah.
I mean, the research that I've read around diet and microbiome, I just want to get your view on it, because the kind of essence of most of the research I've seen tends to say plants good, meat's bad. I mean, have I interpreted that wrong, or what's your views on that?
I would more say not necessarily meat is bad. It's more that fiber is good, and fiber is normally linked with plants. So it's that thing of actually having access to fiber is actually quite important for the microbial communities. Yeah. So
in your opinion, it's not that meat's bad, and obviously some meat is bad if it's been raised very badly, but the key is that you're getting adequate fiber for what your needs are.
Yes. And, you know, if you look at the research around that, you'll see that most of us in the Western world don't meet our fiber requirements, you know, daily. So even though we have so much food available to us, we're not meeting the fiber requirements that are thought to be needed to maintain a healthy microbiome.
Yeah. Yeah. Gotcha. So again, we've kind of touched on this already, but if you could go into a bit more detail, what would you say are the main problems that can occur when the microbiome is unbalanced?
So again, I guess it depends on which microbiome we're speaking about. But if we start with the obvious, which is the gut, the first and foremost, often people will get local symptoms. So we can think about that with all the microbiomes, the mouth, the gut, the vagina, you know, the penis. There'll often be local symptoms of the imbalance. So whether that's pain in the area, when it comes to the mouth, it might be tooth decay. When it comes to the gut, it might be, you know, IBS, IBD, sort of uncomfortable symptoms in the gut. In the vagina, it would be pain, you know, and inflammation in the vagina. So, you know, so that's the local problems that can happen. And then again, when we come back to the gut, then we have to think about it as, because so much goes in and out, you know, via the barriers there, how it then links to our immune system, to our, how it plays a role in what goes in and what comes out. And that can change things like our hormonal balances. It can change things like how our immune system works, how our, you know, our kind of, like different kind of, what am I talking about? Metabolic processes like, you know, blood glucose metabolism, things like that can all be disrupted. So then you have all the secondary knock-on effects, basically, of kind of the local damage that happens. Does that make sense?
And what would just be some examples of more systemic conditions that could be caused by an imbalanced microbiome?
So basically, an imbalanced microbiome has been linked with most chronic diseases. So that's everything from metabolic syndrome to autoimmune conditions is a very, very big one. There's lots of links with different autoimmune conditions, skin conditions, if you mentioned earlier, such as eczema and atopic dermatitis and psoriasis. So it's those, and even chronic sort of cardiovascular disease conditions and so on and so forth. So again, it may not be the only causative factor, but it's generally what we call a very, very big mediator of a lot of these problems.
Yeah, and I know the oral microbiome is linked with heart disease, isn't it?
Yeah, absolutely. Heart disease, big one with rheumatoid arthritis as well, the oral microbiome, as well as obviously, local problems too.
Yeah, I was just thinking that, heart disease is the biggest killer in the Western world. And how many cardiologists have a discussion with patients about their oral cleanliness and microbiome? I'm guessing it's probably not that many.
Yeah, and as periodontitis, there's some really clear papers around periodontitis, which is inflammation of the gums with microbial, imbalance, basically, is very much linked with cardiovascular disease and increases the risk. So, yeah, it's definitely worth seeing your dentist.
Yeah, and also root canals are also connected with heart disease, because what you're doing, I don't know if you've looked into this, Debbie, but when you have a root canal, and obviously you're blocking the root canal, what happens is the microbes that live in the tooth, so you have thousands of miles of tubules in each tooth, and you have aerobic bacteria, and when you block off the oxygen, the only way they can survive is to mutate into anaerobic bacteria, and then they start producing really potent toxins, and that's been linked to heart disease.
Yeah, there's the P. gingivalis is a really big one that's been linked. There's also some of the streptococci, and also what's the other one? The enterococci, which are really quite common. Enterococcus faecalis, especially, is quite a common bacteria that's linked with sort of root canal failures and abscesses and things like that. That can all play a role, basically.
I'm guessing menstrual issues would be related to the vaginal microbiome.
It can be, menstrual issues, obviously, there's a big story around those, because that can be the gut microbiome as well, actually. But yes, there is a vaginal microbiome, there's an endometrial microbiome. So lots of reproductive issues there can be imbalances there as well. So again, it might not be the only causative factor, but it might be a mediating factor in what's going on.
Gotcha. So as a clinician yourself, working with clients, what's been what would you say were the top most common conditions that you've seen related to the microbiome?
Autoimmune, I guess, is one of the things that really, I think, requires a lot of work with the microbiome, especially the gut and oral microbiome. Working in female health, like looking at the vaginal microbiome, just from a kind of a local standpoint about how that's not talked about enough and how that can really play an impact on kind of women's comfort, but also infertility, I think is a really important one to kind of get familiar with and work with and know how to intervene upon. And obviously from a mental health point of view, I do really think that the gut microbiome is really, really linked, and often, there's often a lot of symptoms of gut imbalance and gut pain, and when it comes to mental health, and how to gently be able to support both is quite important too.
Yeah, I guess autism is an example of that as well, isn't it? That often you get children with autism, they normally have some kind of gastrointestinal problem, and obviously they've got a brain issue. They generally come hand in hand, don't they, with autism? Yeah,
it's quite interesting. The research around that is, what they're not sure of is if the microbiome changes are due to the limited diet that also can happen in autism due to the sensory processing problems, and the fear of different textures and things like that as well. But yes, there's often problems with the gut from day one in autism, and that can be both kind of genetic, familial, and also microbiome as well related. So it's often, like you say, an ongoing issue for them to be able to work with that, because I think in anyone that's got any sensory processing issues or kind of anxiety, I think if you realize, if you've got pain in your gut, it's another layer of information that's coming into your nervous system that you have to deal with. And I think if we're looking at sort of triggers in your day of what can send you into an anxiety spiral, if you've constantly got pain in your gut, it can worsen different behaviors and anxiety, because it's just this background noise that you always have to try and, your nervous system's trying to deal with. So definitely trying to keep on top of the microbiome and the gut pain is really can be helpful in kind of making sure there's energy to spare to manage other daily triggers in people's lives as well.
Now, what's interesting that we're almost an hour in and we haven't even spoken about irritable bowel syndrome or irritable bowel disease. Mm-hmm. Do you want to talk a little bit about those?
Yeah, I can do. So irritable bowel syndrome is an interesting one because basically it's a label for a conglomeration of different ways in which you can get bowel pain or bowel disturbance, let's say. So just because you've been labelled with IBS doesn't necessarily mean it's all the same for everyone. Everyone's got their own flavour, basically. And generally, in many, many cases, the microbiome is involved. There often is links with dysbiosis. In some people, there is like very overt pathogens that can be present that, haven't been picked up. But in many, many cases, it's more subversive than that. It's generally just general imbalances and not being able to digest certain foods properly that can cause problems and so on and so forth. So there is a very, very big link. But when you start reading the literature, it's not like I've got IBS, so I've got this microbial pattern, because like I said, it comes in many flavors. So it's basically, I've got IBS, I might have this pattern, this pattern, this pattern, or this pattern. And then it's really how then do we work with that to bring back an overall state of balance. And it's going to be different interventions for different people. And this is why not one intervention will always work for one person when it comes to IBS. And it's not always just one microbe to blame. It often can be, my IBS might look different to yours. It's that sort of thing. And the story about how we got there, the microbial story as well as the physical story.
And that's obviously where testing can be very useful, which we'll come on to. So can you just talk about the kind of symptoms that people generally experience with IBS?
Sure. So normally a very big one is bloating. They'll complain of bloating, changes in stools. So either constipation or diarrhea. It might be multiple stool movements during the day. And often can be linked with things like anxiety, and often there can be a lot of pain, both locally and again can be linked with joint pain and things like that as well. And often, these kind of flares of IBS, when there is the pain, the bloating, it can be linked with sort of anxiety and mood changes and things as well. So there's often a very kind of systemic kind of issue that can go on there. Often can sometimes be linked with things like fibromyalgia, so pain in the muscles as well, insomnia, so lack of sleep. Again, everyone's going to have a different flavour of what it looks like for them and how it impacts their lives.
Yeah, what's quite interesting for me, because I've been working with, athletes, and I've been working with clients with injuries over the years. And I don't know if you're aware of this, but if you have any kind of inflammation in the gut, what it does, it creates what's called a viscerosomatic reflex, and it actually inhibits the type 1 muscle fibers on the muscles that are innervated by the same nerves as the organs. So if anyone's got any kind of inflammation, what it does to people that are active, it actually creates instability in their lumbopelvic region, which means they can't stabilize their limbs, their lower legs, they can't stabilize their upper arms, they can't perform to their best, and they're likelihood of injury is significantly increased. So when I'm working with people that are in pain, or it could be their sports injuries, or even an athlete just wants to, win a gold medal at the Olympics, gut health is right up there at the top of the priorities, because without that, you just can't operate at your best.
Yeah, that's really interesting, isn't it? It's the, how all these things are interlinked. So the one thing we still haven't mentioned is irritable bowel disease. Do you want to talk a little bit about irritable bowel disease? Oh, inflammatory bowel disease.
Yeah.
So inflammatory bowel disease is a little bit different in as much as it's a autoimmune kind of based condition in which the wall of the bowel is basically attacked, and it can present in different ways. There's Crohn's and ulcerative colitis are the most common, but there's also microscopic colitis and other types as well. And basically it's where your breakdown of the barrier between, your microbial world and the rest of you really breaks down, and you end up with, painful ulcers within the gut. And again, the symptoms are generally increased stool movements, a lot of pain, bleeding via the anus, all of these sort of things. And obviously problems getting nutrition in, so it can lead to other conditions as well. So, and these can be quite serious, can hospitalize people and really put people at risk of other conditions as well. And the problem is then the patterns of microbes are actually quite clear. With ulcerative colitis and Crohn's, we can see really quite distinct changes to the microbiome, and there's quite a clear pattern that is happening in that dysbiosis. But obviously the problem is you've broken the barrier between, your gut and the rest of the body. So you can also have problems like sepsis, where you're taking on too much microbial matter and stuff as well. So it's a bit of a tricky situation that needs sometimes medical intervention as well, when it's at its peak, to be able to make sure that you don't develop sepsis or anything along those lines. But definitely working with the microbiome in between flares can really help keep people out of remission and be really important for kind of managing times of flares and things like that as well.
If you're enjoying this podcast so far and want to watch the full unedited version, head on over to our Patreon channel at www.patreon.com/Radical Health Rebel, where you can support the podcast for as little as a takeaway coffee and receive lots of other premium content and discount offers. Thanks for watching.